Introduction to Pediatric Dentistry. Hi. Earlier this year, we had a group of freshmen getting acquainted with each department of dentistry through introductory postings. They seemed amused to see a section of the building that looked distinct from the rest as they gazed at the colorful walls and the play area until they heard a child scream. The treatment area was filled with children of different age groups, accompanied by adults with a variety of complaints. One young mother had a baby born with neonatal teeth. Another patient was here for a follow up, a child of 2 to 3 years with a cleft palate. There were a few 6 to 8-year-olds with toothache seeking treatment for the same. There were also early teens undergoing appliance therapy. Apart from them, there were also special children with various dental needs. A common feeling they all shared was anxiousness, which had to be treated with expertise. The branch of dentistry that is exclusive to children from infancy to adolescence, and the only branch that treats individuals with special healthcare needs, is called Pedodontics or Pediatric Dentistry. Dentists specialized in this field are called pedodontists or pediatric dentists. Now, what does a pediatric dentist do? This branch includes various techniques, procedures, and skills that share a common basis with other specialities, but are modified and adapted to the unique requirements of children. Pediatric dentists are well versed in child psychology to manage the child's behavior on the dental chair. To handle patients' phobia, they enhance the quality of treatment in minimal time with sedation techniques. They monitor children throughout the dynamic phase of growth and development and guide the parents on how to prevent disease. They intercept oral habits such as thumb sucking, tongue thrusting, etc. at an early age. The speciality mainly aims at determining what is best for the child at that moment and for the developing permanent teeth. The membership organization representing this specialty worldwide, called the American Academy of Pediatric Dentistry, has defined pediatric dentistry as an age-defined specialty that provides both primary and comprehensive, preventive and therapeutic oral health care for infants and children through adolescence, including those with special healthcare needs. Let's break this down. The first part of the definition says it is an age-defined specialty, meaning it is limited to a certain age group. The second part describes the main objective of the specialty, using 4 key words. Primary, which means treating the main issue at that moment. Comprehensive, which is the diagnosis and treatment of all the aspects of oral health. Preventive, the main motto and integral part of this field, to prevent dental disease. And therapeutic, because its main aim is therapy or treatment. The third part of the definition explains the set of individuals included. Pop quiz. How is treating a child different from treating an adult? The key differences are anatomical and physiological variation, emotional and psychological differences, behavioral changes, age-related treatments, the relationship between the dentist, child, and parent. Let us discuss them in detail, beginning with the anatomical differences. Children are at a greater risk of airway obstruction due to their narrow nasal passages. The disproportion in the oral cavity to the tongue decreases the diameter of the airway, which is the characteristic feature in infants and young adults. Great care has to be taken when placing dental equipment. The ribs in a child are horizontally placed at a resting position. This leads to a decrease in the function of the intercostal muscles, making the diaphragm the primary muscle of breathing. Therefore, positioning the child in the dental chair with the head at about 20 to 30 degrees is recommended to reduce diaphragmatic exertion. Coming to the physiological differences, the residual volume in children is lower when compared to adults, which makes them breathe faster. Therefore, nitrous oxide is commonly used as a sedative agent. Coming to the gastrointestinal system, the acid concentration is low in the gut when compared to adults because of immature gut mucosa. Therefore, drugs like barbiturates are not well absorbed, while penicillin is a gut-friendly drug in children. Moving on to the renal system, the amount of fluid absorbed by the kidneys in unit time, known as glomerular filtration, is low. Therefore, drugs in high concentrations must be avoided. Lastly, the heart rate in children is as high as 120 beats per minute in a newborn and decreases throughout childhood to reach the average adult heart rate of 70 to 80 beats per minute by 10 to 12 years. Stroke volume is also low in children. These two factors influence the cardiac output, making them more prone to bradycardia. This also influences the uptake of inhaled gases. These factors have to be monitored during sedation. Coming to the psychological differences, children lack the cognitive development as seen in adults and are more centered and attached to their parents. The child's behavior also requires efficient management as they are not expected to accept treatment as readily as adults due to fear and anxiety. Now let's move on to treatment considerations. It has to be altered based on the anatomy and morphology of the primary dentition and the child's acceptance of the treatment. Finally, a significant difference is that while treating an adult, the dentist has to share a rapport only with the patient. Their relationship is linear. In the case of children, parents play a very important role in helping the child bond with the dentist. This relationship was described in the year 1975 by Dr. G. Z. Wright in the form of an equilateral triangle called the Pedodontic treatment triangle. According to Wright, the child is the focus of attention to both the parents as well as the dentist. Therefore, the child is placed at the apex of the triangle, while the dentist and the parents occupy the two corners below, forming the base. The arrows facing one another depict the reciprocal interaction between them. This triangle symbolizes coordination between three elements to create harmony and is the successful path to effective and efficient treatment. The triangle was later modified by MacDonald in the year 2004 when society was added as a new parameter at the center of the triangle, keeping in mind that society has a strong influence over the behavior of the child. This is called the modified pedodontic triangle, where the management techniques have to be acceptable in society. Any variation in the interaction between the dentist child and parent leads to a change in the shape of the triangle. Let us consider two case scenarios. In scenario 1, we have a parent who always answers on behalf of the child. The parent is overindulgent or overprotective, thereby interrupting the communication between the child and the dentist. This is depicted as an isosceles triangle, where the patient or child is passive. In scenario 2, we have a negligent parent, disinterested in the treatment, walks away during the treatment, and is self-indulgent. The dentist's communication is limited to the child, and the parents are at the passive end. This scenario is depicted as a right-angled triangle. New models based on the Pedodontics treatment triangle have been proposed, such as the Pedodontic treatment model, which also includes a pediatrician. In this, the most distinct features of pediatric dentistry are included, such as prevention, risk assessment and management, child psychology, and behavior management. This model uses a square that has the child in the center. A pediatrician is added to the treatment model as they are the first source of information to the parents. Family and society are other factors playing an important role as depicted in the model. A new innovation to the triangle is the Pediatric Dentistry Management Pyramid. It is a visually captivating representation of fundamental variables that influence the effective management of pediatric patients. At the pinnacle of this pyramid lies the child, and four crucial cornerstones are the parents, society, dentists, and electronic screen, forming the foundation of the model. The pyramid also comprises five distinct layers, each representing a specific level of interaction. E-screens is a new parameter added, as this model suggests it plays an important role to distract and relax children during dental treatment. A common query pedodontists get from parents is, but why does my child need a dentist? Milk teeth will fall off anyway. Here's our answer. First of all, primary teeth help to gain adequate nutrition for growth and development. They are important for speech development. They are a natural way to maintain spaces for permanent dentition. They also help the jaws grow. And they help in the eruption of permanent teeth in the desired space and guide the eruption. A healthy smile always helps children feel good about how they look. So, when does the child need to see a dentist for the first time? The common thought is that a dental appointment is required only when the child experiences discomfort or pain. But this is a wrong notion. AAPD in the year 2018 recommended the first visit should be initiated as soon as the first tooth erupts in the oral cavity or within the first year of birth. The preventive and educational aspects start much earlier with parental counseling. It also helps the children familiarize with the environment of the dental clinics and the pediatric dentists. Pop quiz. Dental problems in children alter their health and their lifestyle extensively. Pedodontics aims to make dental treatment enjoyable for kids as well as the pedodontist herself. I mean, who wouldn't want a colorful clinic and quirky scrubs? With this, we come to the end of this video. Here are some interesting facts for you. Feel free to take a screenshot. We hope you had fun learning with us.